And welcome to this overview video of the Polar Dashboard tool we've developed for the Care Coordination Project. My name's Greg Bishop, I'm the Chronic Disease Lead, and with me I have Lindy Dell.
Hi everybody.
Lindy, your role at Semfin is?
Senior Digital Health Officer. I mainly work with Polar.
Great, so we've got our resident Polar expert with us today, which is great. So if practices want to get to this main page and get the report, how do they do that, Lindy?
Log on to Polar as normal. If they click Reports, these tabs will come up and they can access the Care Coordination tab.
Rightio, so let's have a look at that. So the first page you'll see shows the patients enrolled that you currently have enrolled in the activity and also the patients you've ever enrolled. So there will be a difference between those, and Lindy is now showing the patients that have had 12 months of care. So you can see you're not going to have any patients enrolled for 12 months of care until obviously 12 months are up. The next tab below that is a patient numbers tab, and you can see there that we've got the patients enrolled, and we can expand on that one there, Lindy, can't we?
We click on the expander tool and up comes the table.
Right, and then you can see the breakup of the patients you've enrolled based on the enrolment code you've used. So you can see the codes are all represented there on the bottom, and then how the numbers are spread across those total enrolments is indicated by the various colours. Now this practice has milestones of 20 patients to enrol and 40, so that means this practice is a $125,000 practice of funding, and they will be a CC1 practice.
We close this screen in the top right hand corner.
And down the bottom we have another tab which shows duration of care, and that's pretty self-explanatory. Month by month you'll see right up to 24 months it shows the number of patients you have enrolled. So you can see there we've got 4 patients enrolled for 3 months and 11 patients enrolled for 2. And right up to 24 months over the life of the project. So that's just a good way to keep track of the numbers there as well. So if we go to the patient activity tab now, so this tab records or shows all the activities that you put in for patient activity. You will see there that it shows full name. Now this is only available within your practice. De-identified data goes to Semfin, so we will not see any name at all in that data. You can then filter these activities. So you can see here, if you just want to see the patients you've enrolled for 2 months, you just select the indicator. And that will just list the patients enrolled for 2 months. And you just clear that by clicking the tab there, Lindy, is that right?
That's correct. Click the little cross on the top toolbar.
And if you scroll over the headings there, you'll see it provides further detail around that for each of those activities, and that aligns to the Ready Reckoner code sheet that you have. And in the bottom left hand side you'll see there's a legend which shows some indicators or gives you colours of patients that may need some attention. And if you click the patient enrolment tab there that you just scrolled over, Lindy, so this you can actually select to filter by the patient enrolment type. So if you just click the first one, that will show patients with 2 or more chronic diseases, and then you could apply a further filter, Lindy, is that correct?
Yep, you can then filter by month, so we can click on the month filter and go for 3 months enrolment, tick the green tick.
Right, so if we look at the top we can see that the tab shows that we have chronic disease patients and they're enrolled for 3 months, filtered there to give us a list, so that's great. And that's just clearing the filter now to get back to the full list. And we can expand on that table as well, can't we?
Yep. Click on the expander tool.
And that just shows a full page of those activities. And you can scroll across, and we've covered everything there, including total Medicare billings at the end. And we just close that in the top right hand side. And the next tab is the HARP tab. So this shows the hospital admission risk profile for patients within your practice. So there's a whole of practice score there, and patients enrolled in the care coordination activity. So that allows you to look at data, identify areas that might need attention, or it certainly may show you the numbers of patients you have enrolled that are at higher risk. And the patient activity tab now, folks, is just the activities for the practice. So you remember when you put the codes into your software. You created a dummy patient, and that was to capture the practice activity. So this page here captures those codes to show you the deliverables for the practice, and you'll see they're all listed across the page there, and that can also be expanded. And there you can see all the codes, basically exactly the same as on your the Ready Reckoner sheet, and the codes on the activity you've recorded is shown there. So this is just a quick overview of the tool. We encourage you to use it. We've developed it to reduce your reporting requirements and to help you look at your activities under the contract and the schedule, and a way to monitor those and measure them. We'll also have access to all the practice data de-identified, as I said before, so that we can see how you're tracking as well. This is our first version, so we may look at making some improvements down the track. If anyone has any feedback or any questions, Lindy, they can contact the Digital Health team.
Yes, at our Digital Health email of digitalhealth@sempen.com.au. .org.au.
Okay, that's great. Thanks, Lindy. So, folks, there's that email address if you have any queries. We encourage you to use the tool. We think it's great and will save you a lot of time. And look forward to talking to you again soon.
Bye, everyone.
Bye.